Higher mental functions. Assessment of higher mental functions is an integral, important, and essential first step. Important and essential first step in the neurological examination. It is the first step of the neurological examination. What is higher mental function? Right? It makes the rest of assessment more valid. Hence, appropriate interpretations can be made. Okay, it makes the very helpful more valid, right? Now the first of all is levels of consciousness, that we can learn about how conscious we are, right? For example, we can take R also the example, right? How conscious levels are we have. Levels of consciousness or arousal. Definition is that it is defined as the state of full awareness, a state of full awareness and being fully oriented to the time, place, and person. These three factors are more important: time, place, and function, or a person. Sorry, right? The person is fully oriented or not, fully aware or not, responding to the given stimuli in the most appropriate manner. If we give the stimuli, they can understand about it, the time, place, and person or not. That is important, right? Depends on the brainstem and cortical functioning. Okay, it is dependent on the brainstem and the cortical functioning. The assessment indicates that the patient will respond to the rest of the assessment in the most effective manner. Okay, the patient will respond to the rest of the assessment in most effective manner. 5 stages of the consciousness is the consciousness. First of all, is the consciousness is refer 5 stages are there. So it refers to the state of arousal accompanied by awareness of one's environment. A conscious patient is awake, alert, and oriented to his or her surroundings. जो कॉन्शियस होता है उसे इट विच इज़ अवेक, alert and oriented, right? The second is lethargy, right? The second one is the lethargy. It refers to the altered consciousness in which the person's levels of arousal is diminished. जो पहले थे उससे it is diminished. The lethargy patient appears drowsy when questions can open to the eyes. In this we can take an example of R in class. In sometime we feel drowsiness and all. So it is a funny thing, right? But when questions can be open to the eyes and response briefly, patient easily falls asleep if not continually stimulated and does not fully appropriate to the environment. And the third one is delirium. Delirium is an acute or subacute hours to days onset, a grossly abnormal mental state of exhibiting functioning consciousness, disoriented, heightened, and irritability and hallucinations. Is an acute and subacute onset, grossly abnormal mental state of okay. The fourth one is obtundation, refers to the moderate reduction in the patient's level of awareness. Moderate reduction. Moderate reduction in the patient's level of awareness, such as a stimuli. Mild to moderate intensity. Mild to moderate intensity, it is also fails when arousal does occur. The patient is slow to respond. Okay. Stupor may be defined as unresponsiveness to all but the most vigorous of the stimuli. The patient quickly drifts back into the deep sleep-like state of cessation of the stimuli. Coma is very severe. In unarousable unresponsiveness, the most intense or vigorous of noxious stimuli may or may not elicit reflex motor response. We sometimes give the external stimuli and all, but sometimes gives or sometimes it not gives. Okay, so cognitive is the process of knowing, including awareness, reasoning, judgment, and institution memory.